Question 1. A patient with severe burns is admitted to the ICU. What is the priority intervention in the first 24 hours? A. Administer IV fluids to prevent shock. B. Initiate nutritional support. C. Start broad-spectrum antibiotics. D. Prepare the patient for wound debridement. Answer. A. Administer IV fluids to prevent shock. Rationale. The priority in the first 24 hours after severe burns is to prevent hypovolemic shock through fluid resuscitation. Nutritional support and antibiotics can be initiated later. Question 2. A nurse is caring for a patient with an indwelling urinary catheter. The patient develops a fever and confusion. What is the nurse's immediate concern? A. Urosepsis. B. Bladder infection. C. Urinary retention. D. Catheter migration. Answer. A. Urosepsis. Rationale. Fever and confusion in a patient with a catheter could indicate urosepsis, a life-threatening infection that requires immediate intervention. Question 3. A nurse is caring for a patient with an elevated INR. The patient has recently undergone surgery. What is the most critical action the nurse should take? A. Administer a vitamin K injection. B. Continue monitoring the patient's vital signs. C. Increase the patient's fluid intake. D. Reassess the surgical wound for bleeding. Answer. D. Reassess the surgical wound for bleeding. Rationale. An elevated INR increases the risk of bleeding, especially post-surgery. The nurse should prioritize assessing the surgical site for signs of hemorrhage. Question 4. A nurse is caring for a patient with suspected meningitis. What is the priority intervention? A. Administer antibiotics immediately. B. Apply a cooling blanket to reduce fever. C. Elevate the head of the bed. D. Perform a lumbar puncture to obtain cerebrospinal fluid CSF. Answer. A. Administer antibiotics immediately. Rationale. Meningitis requires prompt antibiotic therapy to reduce the risk of complications. A lumbar puncture is essential but can be done after initiating treatment. Question 5. A patient post-appendectomy is experiencing hypotension and tachycardia. What is the nurse's priority assessment? A. Check for signs of wound infection. B. Monitor urine output for signs of renal failure. C. Assess for signs of internal bleeding. D. Administer a blood transfusion. Answer. C. Assess for signs of internal bleeding. Rationale. Hypotension and tachycardia post-surgery are indicative of possible internal bleeding, which must be identified and treated immediately. Question 6. A nurse is caring for a patient with severe dehydration. The patient has a low blood pressure and elevated heart rate. What is the first step in managing this patient? A. Administer intravenous fluids. B. Administer pain medication to reduce discomfort. C. Monitor vital signs every 30 minutes. D. Provide oxygen to improve perfusion. Answer. A. Administer intravenous fluids. Rationale. The immediate treatment for dehydration-induced hypotension and tachycardia is IV fluid resuscitation to restore blood volume and improve perfusion. Question 7. A nurse is caring for a patient who has been on mechanical ventilation for 10 days. The patient develops a new cough and fever. What is the nurse's first concern? A. Ventilator-associated pneumonia, VAP. B. Acute respiratory distress syndrome, ERDS. C. Pulmonary embolism. D. Aspiration pneumonia. Answer. A. Ventilator-associated pneumonia, VAP. Rationale. Ventilator-associated pneumonia is a common and serious complication of prolonged mechanical ventilation, requiring immediate attention and intervention. Question 8. A patient who has just had a stroke is admitted to the hospital. What is the nurse's most critical priority in the first 24 hours? A. Preventing aspiration. B. Monitoring blood pressure. C. Providing emotional support. D. Administering thrombolytics. Answer. B. Monitoring blood pressure. Rationale. Blood pressure management is crucial in the first 24 hours after a stroke to prevent further brain injury. Preventing aspiration is important, but blood pressure stabilization comes first. Question 9. A nurse is caring for a patient with heart failure who is exhibiting signs of hypoxia. What should the nurse do first? A. Increase the oxygen flow rate. B. Notify the healthcare provider. C. Administer diuretics. D. Assess lung sounds for fluid accumulation. Answer. A. Increase the oxygen flow rate. Rationale. In hypoxia, the priority intervention is to increase oxygenation to improve tissue perfusion. Diuretics and assessment for fluid accumulation can follow after stabilizing oxygen levels. Question 10. A nurse is caring for a patient receiving a blood transfusion and notices the patient's face is flushed and the patient reports itching. What should the nurse do first? A. Stop the transfusion and assess the patient's vital signs. B. Continue the transfusion and monitor for further symptoms. C. Administer an antihistamine to relieve symptoms. D. Notify the healthcare provider but continue the transfusion. Answer. A. Stop the transfusion and assess the patient's vital signs. Rationale. Flushing and itching may indicate an allergic reaction, which requires stopping the transfusion immediately to assess for a more severe reaction. Question 11. A nurse is caring for a patient with a tracheostomy who is showing signs of a mucus plug. What should the nurse do first? A. Suction the patient's airway. B. Notify the physician. C. Administer bronchodilators as ordered. D. Increase humidification to thin secretions. Answer. A. Suction the patient's airway. Rationale. Suctioning is the immediate intervention for a mucus plug to clear the airway and relieve the obstruction. Humidification and bronchodilators are supportive measures. Question 12. A nurse is caring for a patient who has developed acute kidney injury, AKI, after taking nephrotoxic medications. What is the nurse's priority action? A. Monitor the patient's creatinine levels and urine output. B. Increase the patient's fluid intake. C. Administer sodium bicarbonate to alkalinize the urine. D. Discontinue the nephrotoxic medications immediately. Answer. D. Discontinue the nephrotoxic medications immediately. Rationale. The first step in managing AKI due to nephrotoxic medications is to discontinue the offending agent. Monitoring and supportive measures follow. Question 13. A nurse is caring for a postoperative patient who develops signs of pulmonary embolism, PE, including sudden shortness of breath and chest pain. What should the nurse do first? A. Administer oxygen therapy and call for emergency assistance. B. Administer a thrombolytic medication. C. Reassess the patient's vital signs every 15 minutes. D. Prepare the patient for a chest CT scan. Answer. A. Administer oxygen therapy and call for emergency assistance. Rationale. Oxygen therapy is the immediate intervention for a suspected PE, followed by emergency assistance. Thrombolytics and diagnostic tests can be done afterward. Question 14. A nurse is caring for a patient with an indwelling catheter who reports new-onset flank pain and fever. What should the nurse suspect? A. Pyelonephritis. B. Bladder infection. C. Urethritis. D. Catheter migration. Answer. A. Pyelonephritis. Rationale. Flank pain and fever in a patient with an indwelling catheter are classic signs of pyelonephritis, which requires immediate treatment. Question 15. A patient with chronic obstructive pulmonary disease, COPD, is admitted with increased dyspnea. What is the nurse's priority intervention? A. Administer oxygen therapy to relieve hypoxia. B. Administer a bronchodilator to open airways. C. Encourage the patient to cough and deep breathe. D. Increase the patient's fluid intake to thin secretions. Answer. B. Administer a bronchodilator to open airways. Rationale. In COPD exacerbation, administering a bronchodilator is the first step to open the airways and relieve dyspnea. Oxygen therapy and other interventions follow after bronchodilation. Question 16. A nurse is caring for a patient with a newly placed central venous catheter, CVC. The patient develops sudden shortness of breath and chest pain. What should the nurse suspect? A. Pulmonary embolism. B. Pneumothorax. C. Hemothorax. D. Catheter malposition. Answer. B. Pneumothorax. Rationale. A pneumothorax is a common complication of central venous catheter insertion and should be suspected in a patient with sudden shortness of breath and chest pain. Question 17. A nurse is caring for a postoperative patient who develops a sudden increase in pain and an inability to move their leg. What should the nurse suspect? A. Deep vein thrombosis, DVT. B. Compartment syndrome. C. Wound infection. D. Pulmonary embolism. Answer. B. Compartment syndrome. Rationale. Compartment syndrome is a surgical emergency that can cause severe pain and immobility of the limb. Immediate intervention is required to relieve pressure and prevent permanent damage. Question 18. A nurse is caring for a patient with a new diagnosis of diabetes. What should the nurse emphasize as the most important aspect of patient education? A. Medication management and blood glucose monitoring. B. Reducing carbohydrate intake to prevent hypoglycemia. C. Administering insulin based on meal timing. D. Engaging in a regular exercise routine. Answer. A. Medication management and blood glucose monitoring. Rationale. Proper medication management and regular blood glucose monitoring are critical to preventing complications in diabetes. Question 19. A nurse is caring for a patient with a severe allergic reaction to a bee sting. What should be administered immediately? A. Epinephrine. B. Diphenhydramine. C. Oxygen therapy. D. Intravenous corticosteroids. Answer. A. Epinephrine. Rationale. Epinephrine is the first-line treatment for severe allergic reactions, including anaphylaxis, and should be administered immediately to prevent further complications. Question 20. A patient on mechanical ventilation has a sudden decrease in oxygen saturation and is showing signs of restlessness. What is the nurse's first action? A. Suction the patient's airway. B. Increase the oxygen flow rate. C. Check the ventilator settings and tubing for disconnections. D. Administer a sedative as ordered. Answer. C. Check the ventilator settings and tubing for disconnections. Rationale. The first step in managing sudden desaturation in a ventilated patient is to check the ventilator settings and ensure there are no disconnections or malfunctions. Question 21. A nurse is caring for a patient with a newly inserted chest tube. The nurse notices that the drainage amount has suddenly decreased. What is the nurse's priority action? A. Check the tubing for kinks or occlusions. B. Increase the patient's fluid intake. C. Reassess the patient's respiratory status. D. Document the decrease in drainage. Answer. A. Check the tubing for kinks or occlusions. Rationale. A decrease in drainage may indicate a blocked or kinked chest tube. The first step is to assess and resolve any tubing obstructions to ensure proper drainage. Question 22. A nurse is caring for a patient on continuous 4-heparin therapy. The patient's APTT is 120 seconds, and the therapeutic range is 60 to 80 seconds. What should the nurse do? A. Administer a dose of protamine sulfate. B. Continue the heparin infusion without changes. C. Increase the heparin infusion rate. D. Hold the heparin infusion and notify the physician. Answer. D. Hold the heparin infusion and notify the physician. Rationale. An APTT above the therapeutic range indicates the patient is at risk for bleeding. The nurse should hold the infusion and consult the physician for further action. Question 23. A nurse is caring for a patient with acute pancreatitis. The patient suddenly develops hypotension, tachycardia, and a decreased urine output. What is the nurse's priority action? A. Administer an IV bolus of normal saline. B. Notify the healthcare provider. C. Monitor vital signs every 15 minutes. D. Administer pain medication as prescribed. Answer. A. Administer an IV bolus of normal saline. Rationale. The patient is showing signs of hypovolemic shock, likely due to fluid loss from pancreatitis. Fluid resuscitation with normal saline is the first priority to stabilize the patient. Question 24. A nurse is caring for a patient who is post-lung surgery and has developed sudden, sharp chest pain, dyspnea, and tachycardia. What is the nurse's first priority? A. Administer oxygen therapy. B. Check for signs of a pneumothorax. C. Administer pain medication as ordered. D. Reassess the surgical wound for infection. Answer. B. Check for signs of a pneumothorax. Rationale. Sudden sharp chest pain, dyspnea, and tachycardia are indicative of a pneumothorax, a medical emergency requiring immediate assessment and intervention. Question 25. A nurse is caring for a patient with a nasogastric NG tube who is complaining of nausea and vomiting. The nurse notices the NG tube is not draining. What should the nurse do first? A. Irrigate the NG tube with saline solution. B. Reposition the patient and recheck the tube for patency. C. Notify the physician immediately. D. Administer antiemetics as prescribed. Answer. B. Reposition the patient and recheck the tube for patency. Rationale. The first step in managing a blocked NG tube is to check for kinks or dislodgement by repositioning the patient and checking the tube for proper function. Question 26. A nurse is caring for a patient receiving a blood transfusion. The patient suddenly develops chills, fever, and back pain. What is the nurse's first action? A. Stop the transfusion immediately. B. Administer acetaminophen for fever. C. Recheck the patient's blood type and cross-match. D. Increase the transfusion rate. Answer. A. Stop the transfusion immediately. Rationale. These symptoms indicate a potential hemolytic transfusion reaction. The transfusion should be stopped immediately, and the nurse should then assess the patient for further complications. Question 27. A nurse is caring for a patient with a history of heart failure. The patient suddenly develops severe dyspnea, orthopnea, and pink frothy sputum. What should the nurse do first? A. Administer a diuretic as ordered. B. Administer oxygen and sit the patient upright. C. Monitor the patient's vital signs. D. Prepare the patient for intubation. Answer. B. Administer oxygen and sit the patient upright. Rationale. These signs suggest acute pulmonary edema. Administering oxygen and positioning the patient upright are priority actions to improve oxygenation and relieve dyspnea. Question 28. A nurse is caring for a patient with a history of hypertension who is experiencing a sudden severe headache and visual disturbances. What should the nurse do first? A. Administer antihypertensive medications as prescribed. B. Measure the patient's blood pressure. C. Prepare the patient for a CT scan. D. Assess the patient's neurological status. Answer. B. Measure the patient's blood pressure. Rationale. Sudden severe headache and visual disturbances in a patient with hypertension could indicate a hypertensive crisis. The nurse should measure blood pressure immediately to guide further action. Question 29. A nurse is caring for a patient with a suspected myocardial infarction, MI, who is receiving morphine for pain relief. The patient becomes hypotensive and bradycardic. What should the nurse do first? A. Administer atropine to reverse the bradycardia. B. Hold the morphine and notify the physician. C. Increase the morphine dose to relieve pain. D. Administer a vasopressor to increase blood pressure. Answer. B. Hold the morphine and notify the physician. Rationale. Morphine can cause hypotension and bradycardia, so the nurse should hold the medication and notify the physician for further instructions. Question 30. A nurse is caring for a patient with a history of diabetes who is experiencing signs of hypoglycemia. What is the first intervention the nurse should take? A. Administer insulin as ordered. B. Administer glucose orally or IVC monitor the patient's blood glucose levels. D. Encourage the patient to eat a small meal. Answer. B. Administer glucose orally or IV. Rationale. The first action in hypoglycemia is to administer glucose to rapidly increase blood sugar levels and prevent further complications. Question 31. A patient is admitted with acute alcohol withdrawal. What is the nurse's priority intervention? A. Administer lorazepam as prescribed. B. Provide a quiet and dark environment. C. Administer fluids to prevent dehydration. D. Reassure the patient to reduce anxiety. Answer. A. Administer lorazepam as prescribed. Rationale. Benzodiazepines like lorazepam are the first-line treatment for alcohol withdrawal to prevent seizures and delirium tremens. Question 32. A nurse is caring for a patient with a suspected stroke. The patient has an elevated blood pressure and is not responding to verbal stimuli. What is the nurse's priority? A. Administer a blood pressure-lowering agent. B. Prepare the patient for a CT scan. C. Administer a thrombolytic agent. D. Elevate the head of the bed to 30 degrees. Answer. B. Prepare the patient for a CT scan. Rationale. Immediate imaging is necessary to differentiate between ischemic and hemorrhagic stroke. Thrombolytic therapy can be administered if the stroke is ischemic, but imaging is the first priority. Question 33. A nurse is caring for a postoperative patient with a PCA pump for pain management. The patient reports severe drowsiness and shallow breathing. What is the nurse's immediate priority? A. Increase the PCA pump dose. B. Assess the patient's respiratory rate and oxygen saturation. C. Administer naloxone to reverse the effects of the opioid. D. Decrease the PCA pump dose. Answer. B. Assess the patient's respiratory rate and oxygen saturation. Rationale. The patient may be experiencing respiratory depression due to opioid use. The nurse should assess vital signs and oxygen saturation to determine the severity of the situation. Question 34. A nurse is caring for a patient who is receiving chemotherapy. The patient suddenly develops a fever, chills, and hypotension. What is the nurse's immediate concern? A. Neutropenic fever. B. Blood transfusion reaction. C. Acute tumor lysis syndrome. D. Hemorrhagic cystitis. Answer: A. Neutropenic fever. Rationale: fever and chills in a chemotherapy patient could indicate a life-threatening neutropenic fever, which requires immediate antibiotic therapy. Question 35. A nurse is caring for a patient who has just had a total knee replacement and is experiencing increased pain and swelling in the affected leg. What is the nurse's priority action? A. Elevate the affected leg. B. Check for signs of deep vein thrombosis, DVT. C. Administer pain medication as prescribed. D. Apply a cold compress to reduce swelling. Answer: B. Check for signs of deep vein thrombosis, DVT. Rationale: increased pain and swelling postoperatively could indicate DVT, which requires prompt assessment and intervention to prevent complications. Question 36. A patient is receiving an IV infusion of sodium bicarbonate for metabolic acidosis. The nurse notes that the patient's urine output has decreased significantly. What should the nurse do first? A. Increase the IV infusion rate. B. Assess the patient's renal function. C. Administer an additional dose of sodium bicarbonate. D. Notify the physician immediately. Answer: B. Assess the patient's renal function. Rationale: decreased urine output may indicate renal impairment, which is a concern when administering sodium bicarbonate. The nurse should assess renal function to guide further actions. Question 37. A nurse is caring for a patient receiving a continuous infusion of propofol for sedation. The patient suddenly becomes hypotensive and bradycardic. What should the nurse do first? A. Discontinue the propofol infusion. B. Administer atropine for bradycardia. C. Administer IV fluids to restore blood volume. D. Notify the physician immediately. Answer: A. Discontinue the propofol infusion. Rationale: propofol can cause hypotension and bradycardia. The first priority is to stop the infusion to assess and correct the patient's vital signs. Question 38. A nurse is caring for a patient who has just been extubated following surgery. The patient begins coughing and exhibits signs of aspiration. What is the nurse's first priority? A. Administer oxygen. B. Reposition the patient to a side-lying position. C. Administer an antihistamine. D. Call the physician. Answer: B. Reposition the patient to a side-lying position. Rationale: repositioning the patient to prevent aspiration is the first priority. Oxygen and other interventions can follow. Question 39. A nurse is caring for a patient in the emergency department who has been diagnosed with an overdose of acetaminophen. What is the first intervention? A. Administer activated charcoal. B. Administer N-acetylcysteine, NAC, as prescribed. C. Check the patient's liver function tests. D. Provide IV fluids to flush out the acetaminophen. Answer: B. Administer N-acetylcysteine, NAC, as prescribed. Rationale: N-acetylcysteine is the antidote for acetaminophen overdose and should be administered as soon as possible to prevent liver damage. Question 40. A nurse is caring for a patient who is receiving mechanical ventilation and develops a sudden drop in oxygen saturation. What should the nurse do first? A. Increase the oxygen concentration. B. Suction the patient's airway. C. Check the ventilator settings and tubing. D. Administer a bronchodilator. Answer: C. Check the ventilator settings and tubing. Rationale: the first priority is to check the ventilator settings and ensure the tubing is intact. After addressing potential equipment issues, suctioning and other interventions can follow. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.